Beauty is something that comes from within, and that's what that means to me. To see someone to have that has confidence, that has an inner beauty, it almost makes you radiate and glow on the outside. See that inner beauty come out is just that a confident inner glow, I think. It's not what's on the outside, it's how you feel on the inside. When you look in the mirror, how do you perceive yourself? And I want you to look at yourself in a way that is appreciative of where you've come from and where you're at right now, and just to help you gain a little bit more confidence moving forward without you feeling not yourself.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Wendy Ferguson of Define Aesthetic Studio, who is a skilled aesthetic injector with a master's degree in nursing education. With a strong foundation in clinical excellence and a passion for artistry, she is dedicated to providing safe, high-quality care that enhances each patient's natural beauty. Wendy's approach blends medical expertise with an educator's precision, ensuring her clients feel informed, comfortable, and confident in their results. So Wendy, welcome and glad to have you here.
Hi, thank you for having me. I'm really excited to be here with you today.
Yeah, so let's start with this. How did you first get interested in medicine, Wendy?
It's actually I've been in healthcare for a very, very long time, but always working either in a medical office or a dental office, but in the front office area. But always wanted to dive deeper and be in the back, wanted to be hands-on, wanted to be chair side. And after I had my son, I decided to go back to school and go to nursing school. And my passion for education and just wanting to learn more evolved from there. And I started with an associate's degree in nursing, then got my bachelor's, and then eventually my master's degree in nursing education. And I just really love the learning aspect of things. I'm always on Google or always trying to research more ways of just learning, not necessarily everything in aesthetics, just anything in general. So it's a big passion part of me. So
Okay. So you had this very deep knowledge and background in healthcare. So I'm curious, what was it about aesthetics that really drew your attention and got you more into the aesthetic side?
well, honestly, I had skin cancer in my early 20s. I'm now
Oh,
50
wow.
years old.
Mhm.
I had malignant melanoma. I was not a sun worshiper. I wasn't out on the beach surfing every day here in Southern California. Just fair skin, never wore sunscreen. My parents never put sunscreen on me. Had a mole that looked pretty suspicious. Went and had it off, didn't think anything of it. And then a week or so later, they called me and told me I had malignant melanoma. Removed it, was completely fine, luckily didn't need to have any further treatments after that, but then just started to be more conscious of how to take care of my skin better, making sure I was wearing sunscreen, and that kind of dove into other things about looking how to take better care of myself in general. And so then my love of nursing and education and aesthetics kind of combined and overlapped, and that's when I started to get into aesthetics, and really started to pursue that.
Okay. And what was it that prompted you to want to start your own practice? I mean, why not just work somewhere else? What really, I guess, motivated you to want to do your own thing?
I did. I honestly contemplated working for other med spas, but I knew I wanted to be independent and wanted to be on my own. I didn't want to work for another office. I had done that in the past, and years experience of being in a medical or dental setting, and I wanted to be on my own. I felt like I had enough experience from those other professions or jobs that I could utilize and kind of incorporate the two together. And I wanted to start out small. I really wanted to offer a personalized service here, in my practice. I didn't want to open a big med spa with a bunch of injectors, and I wanted my clients to come in knowing every single time they're going to see me and only me. We're going to have that, build up that relationship and that trust and that rapport with one another. That way they feel comfortable coming to see me every time. And you can see their their trust in me build as each time they come in and they get a little bit more comfortable, and they'll say, okay, well, now I have this concern or that concern, or just we in the conversations that we have, it just becomes more of a friendship than a client provider relationship.
Okay. And so now that you have your own practice, what are some of the most common treatments that you offer to your clients and your patients?
I offer a lot of stuff, but most of the clients that come in looking for Botox or a neurotoxin treatment for fine lines and wrinkles. But in my client consultations, I'll go over this is a great treatment. However, it's only a Band-Aid. It's only going to last about 3 to 4 months. And it's not addressing the root cause of why you're seeing the wrinkles, why you're seeing the aging that you are experiencing. And we need to find other ways that we can treat it, such as doing chemical peels, microneedling, radiofrequency microneedling, to try to really build and establish more collagen and elastin production to try to slow down the aging process. We're never going to fully stop it. We're all going to age at some point, some people a little bit faster than others, but we can slow it down and try to keep our youth as long as possible.
Okay, so it's really about anti-aging, trying to extend out how young you can look for as long as possible.
It's exactly. And
Okay.
try to keep those results natural. A lot of my clients come in and they're afraid when the conversation of filler comes up, they're afraid of looking unnatural and not looking like themselves or looking like a housewife on TV. And I
Mhm.
try to explain to them that you would need the amount of filler that you would need to get that look is way more than I would ever do for you. I try to keep my results very natural and refreshed. I want you to still look like you, just a more refreshed version of yourself.
Mhm. That seems to be a common fear nowadays when people think about Botox or filler or anything like that. Like the biggest fear is I don't want to look overdone. I don't want to look
For
overdone.
sure. Yeah, yeah.
And I think there's been more of a push of people wanting to have more of that natural look. So it sounds like
Yes.
that's what you're experiencing also in your practice.
For sure. And I'm even seeing a shift from people wanting to do more traditional or new treatments. So obviously we still have fillers, which is a hyaluronic acid and it's injectable. But now we're having treatments like Sculptra or Radiesse, which are collagen stimulating treatments, which you'll see if you're using Radiesse, you'll see results right away. But over the next 3 to 4 months after the treatment is performed, the results are going to get better over time because it's now increasing your own collagen and elastin production. So if I try to say like it looks great right now, but just give it a few more months, it's going to look better in the long run. So they're seeing this shift in aesthetics medicine where it's going to these more natural treatments that are starting to increase one own collagen production versus just putting a bunch of filler in your face and then it wears off in a year and now you're back at your baseline and you're having to start all over again. So yeah, there's radio frequency microneedling. There's a new treatment called SURF, which is radio frequency to help with skin tightening and firming. So there's just a lot of new methods on the market now that patients are looking for to get those results without having to put a bunch of filler in their face.
Okay. And I want to go back to that word you used. What was it collagen
Stimulating, yes.
stimulation? Okay, so collagen
Yeah.
stimulation for people who don't know what collagen stimulation is, because if I think about it, like okay, collagen stimulation, is it growing more collagen? Is it just making my skin look smoother or younger? Like what exactly is goes into that
Yeah,
collagen
so
stimulation?
like as we get older, all of us, probably starting in our early 20s, our collagen and elastin production starts to decrease. And you'll start to slowly see more signs of aging as you get older. So these treatments that induce or help increase your own collagen production will help to smooth out the skin, decrease those fine lines and wrinkles, keep your skin more tight, more firm, and give you a more youthful appearance in the long run versus not doing anything altogether.
Okay, got it. And I want to tie in as far as when it comes to skin tightening, GLP-1s. So
Yes.
the weight loss drug. So GLP-1s have been really just storming the market, and I'm just seeing a lot of people taking it. But particularly the ones that lose a lot of weight really, really quickly. I believe that skin tightening can really help them as far as I think it's like they have stretch marks from losing the weight so quickly. Like, can you talk a little bit more about that? Like how skin tightening can work in conjunction with GLP-1s.
Absolutely. And one of the main reasons I brought on radio frequency and microneedling, and then this new device that I have called Zerf, is because I'm seeing a lot of clients come in on the GLP-1s who have had that rapid weight loss and have had amazing results with it, but now feel like their face is melting off their skin, or their skin's melting off their face, and they're feeling like their skin is a lot more loose or have increase in skin laxity. So these treatments help to deliver heat into the tissue, into where the collagen and elastin is produced to help tighten and firm up the skin. Is it ever like a facelift? No, I'm realistic with my clients, saying like, you're not going to get that result. If you want a facelift result, you're going to have to go and get a facelift. But many of my clients are afraid of that for multitude of reasons. The finance that goes into the cost of a facelift, the risk of like all the different things that can come along with a facelift, infection, results, unwanted results, those types of the downtime, all that kind of stuff. So these treatments can offer immediate results here in the practice, in the chair, and some even over the next few months after the treatment, with little to no downtime, and the cost is relatively affordable for them, and they get really good results with it.
Okay. And so with the skin tightening, is it mostly done on the face, or is it also done on other parts of the body as well?
There are some devices that can do on other parts of the body. Here in my practice, I treat only face, neck, and right in the chest area. But there are other devices or methods on the market that will do tummies, abdomens, buttocks, thighs, those types of things as well. And you can get great results with those too.
Okay. So specifically on the face, and since that's the one that you really do a lot of, when it comes to the face, and these skin tightening treatments, what's the average number of treatments people might need? I know it's going to depend on their
For
situation.
sure.
On average, what do you think?
On average, anywhere from 3 to 5 visits, just depending on the amount of skin laxity. I would say if it's mild to moderate, we could definitely start with 3. If it's more moderate to maybe severe, we would probably need more like 5. And I usually recommend that my clients come back once a year for a yearly maintenance treatment. And sometimes clients, if they can afford it and it's in their budget, I'll recommend 2, come back every 6 months. And that way you're just constantly creating more stimulating more collagen production each time that you come in, and it's like never going into a dull or a lull, so that you're just always regenerating new tissue.
Okay. So, and I'm trying to understand a little bit of the science behind it. You mentioned there was this heating that's done on the skin. So what is it about the heat that I guess causes the skin to tighten up and just pull back? So
Yeah, it creates like a thermal injury, so to speak. And so then anytime there's an injury to the tissue or the skin, your skin kind of goes into a natural overdrive protection of wanting to heal and repair. So it activates or stimulates the cells that are responsible for healing and repair to kind of go into overdrive. And it helps to create new collagen. It sends all those cells to the surface layers of the skin to help heal, repair, and restore. And usually it's for treatments like radio frequency microneedling. After the treatment, you're red for about 1 to 3 days, just depending on how sensitive you are to the treatment. And then 4 to 6 weeks after the treatment is when you really start to see the results with improved texture, improved pore size. Your skin will have a more youthful glow to it, and then you can see the tightening and the firming starting to happen at that time. So yeah, clients that are maybe a little bit younger or have mild to moderate could definitely use 3 treatments. Maybe a little bit older who have been on the GLP-1s would probably need more like 5 treatments.
Okay. Okay. And so I guess it's similar to if you go to the gym and lift weights, every time you lift weights, you're breaking down the muscles, and when it builds back, it comes back stronger. Is that kind of the same concept with this?
Yeah, same concepts. Yeah. I use that analogy a lot with my clients because I feel like that helps. I use a lot of analogies when I'm in practice. I feel like that makes it kind of click with people too. So I'll say it's just like diet and exercise. You have to combine the two. Skin treatments with good skin care, combining the two together is going to get you better results. Working out is a great analogy, and that makes perfect sense.
Okay. And so you mentioned it's going to be anywhere between 3 to 5 treatments on average. What's the time frame between these treatments that is ideal? I mean, can they do it like back to back to back to back, or do you need to give it like a couple of weeks, a couple of days, a couple of months?
Yeah, I usually recommend waiting like 6 to 8 weeks in between each treatment, just to allow your tissue to take that time to get the healing that it needs to. And there is a little bit of downtime with the radio frequency microneedling. With radio frequency without microneedling, like in ZERF, there's no downtime. And there's no needles with that one. With that one, you can immediately go back to work. You could go to an event. You could put makeup on, but I would still recommend waiting the 6 to 8 weeks in between treatment time, just to fully allow the tissue to do what it needs to do. So that way you're not stacking treatments and doing more damage than good in the long run.
Okay. So, and you brought up an interesting point, because you mentioned like with ZERF, there's no needles. So it seems like there's different modalities that people can use for the skin tightening. Is there really any major differences between the different modalities? I mean, you mentioned like some have a lower recovery time, but you still wait that 6 to 8 weeks in between. But are there any major differences between these modalities?
Sure. Well, with the radio frequency microneedling, I have a device here called Potenza, and that one does use needles, tiny microneedles, and that one is great with texture, fine lines, pores, acne scars, and it does help to tighten and firm the skin as well. But there is a little bit more downtime with that, because we think we're using tiny needles into the surface skin along the face, jawline, and neck. You're going to create that micro injury to stimulate that collagen production. With ZERF, that one, there's no needles involved. It's a handheld device that just delivers heat down deep into the dermal layers, even deeper down into the fascia layers, where the structural support of our skin is. And that one just delivers heat solely, and then generates the collagen production that way. And with that one, there's no downtime. You could, like I said, you can immediately go back to work. You can go to an event if you wanted to that day. You can put makeup on. You can go right outside and not look like you've been out in the sun for an extended period of time, like you would with Potenza. Even though with Potenza, it's minimal, 1 to 3 days of downtime. Some people can't afford to take that 1 to 3 days of downtime. Life is busy for them with kids, work, activities, and we're always on the go. So ZERF might be a better alternative for them.
Okay. And as far as the end results go, is there a major difference between the end results for these different modalities?
It kind of depends on what their overall goals are. If their goals or concerns are more textural, I would say do Potenza, the radio frequency microneedling. If their overall goal is skin laxicity and wanting to tighten and firm the skin, then I would say do ZERF, which is the radio frequency microneedling.
Okay, got it. And I'm sure you get this question all the time. How painful is it?
Well, yeah, so Potenza, we do use a numbing cream because there are needles involved, and everybody's pain level or sensitivity is a little bit different. The numbing helps kind of make it more comfortable. We apply a numbing cream on the skin, leave that on for about 45 minutes, maybe to an hour or so, take that off, and then we can do treatment. Most of my clients are very comfortable during the treatment. They might have a few areas that are a little bit more sensitive than others, maybe around the eyes, or maybe the upper lip might be a little bit more spicy or sensitive. With ZERF, there's no needles, so there's no numbing involved. We can immediately do the treatment, be done in 45 minutes, and you're back to work. You can come in on a lunch hour and go right back to work.
Okay. Wow. So I'm curious, when it comes to these treatments, what are some common misconceptions, some common myths that you hear most often? I think I went through some of the questions that came to my mind, just popped in my head, but what are some of the most common misconceptions and myths you hear about this treatment from your patients and your clients?
Well, specifically with any treatment, or specifically to say Potenza or ZERF?
Yeah, for the skin tightening ones.
For the skin tightening ones, obviously the downtime. They don't want to be down. They think they're going to be down for like a week to 2 weeks. And even with the microneedling one, I try to really let them know that, I'll do a treatment on myself, and I have no qualms about going into a grocery store or go home. In fact, I did one on myself maybe a month and a half ago, and kind of forgot that I had done it, and finished up here in the clinic and went and stopped at the grocery store on the way home. And then I got home and my husband's like, "You stopped at the store like that?" And I totally had forgotten that I had done it. And I looked in the mirror, I was like, okay, I am a little bit red, but I don't care. It doesn't bother me. But for some people who are pretty self-conscious about those types of things, I can certainly understand that, their hesitation for wanting to do it is, eliminating the downtime. They don't want to be seen out in public looking like, an ogre or those types of things. So, yeah.
Okay, got it. And now, when it comes to education, how do you approach educating your clients on the benefits of these treatments? Because I'm sure you get some people that come in and it's their first time and they're maybe a little bit nervous and not quite sure what to expect. And I'm sure you get people that they're used to it and it's just like, okay, just what is it? Okay,
For
let's
sure.
go. So, how do you approach that education part of it?
Yeah, like you said, there's different approaches for each client. For those who are very apprehensive and they've never done treatments before, and maybe they're coming to me for Botox for their very first time, I really try to not overwhelm them either with the amount of limitless treatments that we can do here. I really try to focus on their main concerns of why they came in and talk to them and specifically discuss it in a way that makes it a little easier for them to understand. And then as they come back, I'll kind of add things in there and like, revisit those conversations that we had and kind of add a little bit more as we go. That way they can be more informed about moving forward with other treatments. For those who are seasoned aesthetic, you know, patients who have done all kinds of things. Some come flying in the door and hop right in the chair and they're like, okay, yep, numb me up, do whatever you need to do.
Mhm.
Then those ones are ones I can kind of, educate them in a way that, they're very well informed already and they know the downtime, they know the risks, they know those things, but I'm still going to educate them and let them know the risk, the benefits, all those things. Even though it might, they might be patients that have done those things in the past, they're still maybe a first time client with me and I'm still going to present it to them in a way. And a lot of them will say, gosh, I never knew that. I've been doing filler for years and years and years and no one ever told me that. And I'm like, okay, so, maybe they weren't listening before. I don't know, but I
Yeah.
try to really like approach it in a way and offer it in a way that's more one-on-one versus and maybe in a bigger practice where it might seem a little bit overwhelming or a little intimidating to those.
Okay. Now, let's say someone is looking for a good provider who's able to provide them with the education you just talked about and has the skill set, has the experience. What would you say is the most important piece of advice you can give to someone who's looking to find a good provider but just isn't sure? Like where should they
Yeah,
start?
I mean, obviously start research, look in your area for local injectors and really dive into like their Google page and their reviews. Look on their website to see, their credentials. You can look on the Board of Nursing or in those areas to find if they've had any um, restrictions to their licenses, those types of, Google. So use the internet to find a good provider and then meet with them, have a consultation with them. Most providers offer a complimentary consultation. Meet with them, interview them essentially, and find out, if it's something that you feel comfortable doing. You're going to know right away in the first few minutes of meeting with them to know if this is the provider for you or not, and meet with a couple if you want to. Until you feel that you've met the right one. And luckily, depending on the area that you live in, Southern California, we are kind of oversaturated with aesthetic providers. We're on every street corner. There's a few, even in my own building that I'm in, there's a couple other injectors and they're amazing. But yeah, you can find them just about everywhere now. So just
Okay.
research it and interview them.
Okay. And are there any red flags that they should keep an eye out for? Like, oh, they see this and then that's a red flag. You should be really cautious or just run away.
For sure. Services that they're offering at a very discounted price. I've had people that come in and they're like, I found someone that does Botox for like $6 a unit. Can you match that? And I'm like thinking like, that's a red flag, huge red flag, because I can't even, as an aesthetic provider, you can't even get it for $6 a unit. So where are they buying this product? Where are they getting it? So ask your injector, where do you get your product from? Where are you buying your filler, your Botox, and those types of things? And they should be able to tell you it's from a reputable company. Buying products overseas from China, Mexico, or wherever, they're not regulated here in the States. And so I can only buy Botox from Allergan, which is the pharmaceutical company. I can only buy Xeomin from Merz, which is the pharmaceutical company for that particular neurotoxin. So buying them from third-party companies, it's not regulated. You don't know what you're getting in the bottle. So yeah, red flag is price, number one. Or if they're saying like, oh yeah, come in and I'll add on filler for like $100 so you can get your lips done, like any of those types of things. Providers that maybe work out of their home. And I'm not going to discredit, there are some providers that do work out of their home who are doing it legitimately with they're licensed and insured and ordering product from, reputable companies. But there are some that are doing it from home that are not. And so you have to be cautious with that, and don't be afraid to ask them, like, where did they go to school? Where did they get their aesthetics training? How many continuing education courses do they take a year? Like, those types of things, like, are important questions to ask, and don't be afraid to ask those of those providers that you're looking into.
Okay. So, and you bring up a good point as far as the quality of the products. I think many people that aren't so aware, that's like, oh, Botox is Botox is Botox. Like, there's no difference between them. But getting it from the actual manufacturer is critical, like getting the real stuff. And just so people can understand that part of it, is what's the potential risks if someone is using a off-brand or not legitimate product?
Yeah, I mean, there's paralysis of the nerves and the muscles, there's blindness, there's all kinds of different things that we're hearing about. There's cases, if you look online, you can look for, providers here in the US who were saying they were using legitimate products, but then their clients were starting to experience different things. Paralysis of the tongue, paralysis of different parts of their face, having nerve damage throughout their whole body, and just different, results from that. So it's crazy to me that people are so willing to just jump in and let anybody do these types of treatments to them without fully investigating or doing their research, just to save a dollar. To me, it's shocking, honestly, that you'd be, if they're, you can spend $5-6 a day on your Starbucks coffee and you don't think twice about it, but coming in for one of these treatments, and I get it, if you're safe, these aesthetic treatments can be expensive, but they're expensive for a reason. They're expensive because you're paying for the quality of the product, the quality of the service that you're getting, the experience of the injector. So don't discount those types of qualities in a provider just because you're trying to save money.
Very well said. Now, Wendy, when it comes to artistry, how important do you think artistry is in how you approach patient care or in your line of work?
Yeah, it's very important. And I'm not, I just told this story the other day. I went and attended a paint and sip with my family. And you would think that being an aesthetic provider, my painting would have been like the Picasso of paintings, but it was terrible. I was like a kindergartner. So it was so bad. I was like embarrassed to show it. But in this type of setting with my business, it's totally different. I can look at a face and do a full skin analysis, a full facial analysis, and know exactly what areas of the face need enhancements or need support in order to give them the results that they're looking for. And that's all just knowing your anatomy and your physiology of facial structure, and what areas to avoid because of arteries or vessels. And those are things that I've learned along the way by attending different courses and attending different seminars, and just becoming more well knowledged in my area of expertise. So.
Okay. And Wendy, throughout your experience, I'm sure that you've run across some challenging cases. Is there maybe one story that comes to mind that you're okay sharing, of just something that came in a tough or just even memorable case, and you were able to get them a great outcome in the end?
For sure. Yeah, no, I mean, it does happen from time to time, and just to see the overall confidence level of a patient change throughout the visit is amazing. But one that particularly comes to mind is a younger client of mine who suffered from a domestic violence situation years ago. And because of it, she was left with some pretty substantial scar tissue and scarring in her lower lip. And it was pretty obvious just by looking, one-on-one with her. And every time she looked in the mirror, she was reminded of that past instance, and I'm sure suffered some PTSD because of it. And she came in wanting to do lip filler. And so I, over the consultation, looked at her and, I looked at the tissue of the lip, and we came up with a treatment plan. And I was very honest with her and saying, like, I don't know that I'll be able to get them to be completely perfect, as I tell all my clients that no one human being is 100% perfect. We all have some asymmetries, but I'm going to do the best that I can to make some improvement. And so it was a tough appointment, and I was nervous myself even going forward, but I knew my foundations, I knew my anatomy, and I knew that I could make a substantial improvement. And we did. Was it perfect? Could you still see some of the scarring? Yes. And she was aware of that, but she was so excited and happy with her results. When I showed her the mirror, that she was crying. And so it just, you could see like the weight of the past kind of be released from her right in that instance. And so that was like so inspiring to me to know that like I'm in the right area, right field of where I'm supposed to be, and to keep going.
No, I love that story because it's when people think about aesthetics or the aesthetics industry, I think they think more of like, oh, it's about facelifts and getting and just like it's all about vanity. That's the only thing
Right.
I think about. But when I ask providers, what's the most memorable story, the ones that really come to mind, it's always about helping someone just get their confidence back, just
Absolutely.
to feel
Yeah.
like the best version of themselves. It was
Yeah.
never about, oh yeah, I got this person and they're already good and they just want to look even more beautiful. It's never that. It's
Yeah.
always they felt insecure. They felt just they lost all their confidence. And after you're able to help them just look normal, then they got their confidence back.
Yeah, it's crazy to see how quickly that shift, that change happens right in front of you. And I think it's like, I don't want to say that I have a magic wand because I clearly don't. I'm not. But to see that in that instance, that boop, and to see them transform right in front of you is such an amazing experience. And that I feel so lucky to be able to share that moment with them. And they've let me in on such a private, part of their life. And like, I'm just so grateful that my clients trust me enough and sit with me and allow me to have those moments with them. It's such an endearing feeling. I can't
Mhm.
quite describe.
Yeah, I can imagine. And so, Wendy, where do you think the future of aesthetics is going?
Gosh, it's so hard to say because it's changing so rapidly. Like, I just attended a conference down in Miami, and it's always neat to be in a room of colleagues of your peers and kind of like, what are you hearing? What are you hearing? And we're all from different parts of the country, and we can all come together and share our experiences and share kind of what they're hearing. And I do think it's more regenerative medicine and regenerating our own and stimulating our own collagen that's kind of going to be the wave of the future. There's treatments like platelet-derived growth factors that have amazing results, and it's something that I'm looking forward to bringing on and here in my practice. Yeah, I mean, I think it's kind of limitless, honestly. The science behind everything and where it's going to go from here is really exciting.
Okay. And for your practice, Define Aesthetic Studio, what is your vision for your practice?
Just continued growth. People keep asking me like, are you going to open up a bigger spa it's just me. It's a solo me with one
Mhm.
chair. I don't have any assistants. I don't have a front desk person. And I think that's what people love about coming to see me.
Mhm.
It's like coming to see an old friend.
Mhm.
And people have asked me like, oh, do you want to expand? Do you want to make it bigger? And I teeter on that because I feel like I'm going to lose some of that one-on-one um, personal experience that we already have. And so I don't know. I feel like I'm just so happy right where I'm at right now, that just continued growth in my own space and continued getting more education for different things that are coming out there. That's kind of where I see myself going. I don't have this big elaborate game plan of wanting to have like spas in all different parts of the country. Like
Mhm.
that's just not me. I just, I want to be my authentic self with my clients and offer those services in the best way that I can.
Well said. Well said. Okay. Well, Wendy, I have one last question for you. But before I ask it, I do want to point people to your website at defineaestheticsstudio.com. Now,
Yes.
last question for you, Wendy. What does beauty mean to you?
Gosh, beauty is something that comes from within, and that's what that means to me. To see someone that has confidence, that has an inner beauty, it almost makes you radiate and glow on the outside. Clients that come in, you can tell if they lack self-confidence, they're hesitant about showing, they don't even want to look in the mirror sometimes. And when I point out things to them and we make improvements in different areas, it just to see that inner beauty come out is just that a confident inner glow, I think. It's not what's on the outside, it's how you feel on the inside. When you look in the mirror, how do you perceive yourself? And I want you to look at yourself in a way that is appreciative of where you've come from and where you're at right now, and just to help you gain a little bit more confidence moving forward without you feeling not yourself.
Okay. Well, there you have it. Wendy sharing her expertise. So, Wendy, where can people contact you in your practice?
You can either go through my website. I do have an Instagram which is at Define Aesthetics Studio, and you can find me there.
Awesome. Well, Wendy, thanks for coming on. Thank you for sharing your message, and thank you for sharing your knowledge.
Thank you so much for having me. I really appreciate it.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.